Hey guys, this is Dr. Samir Islam. Today we're going to continue our series on celiac. This is video 2. On the first video I actually explained what celiac is. In today's video I want to explain what are some of the symptoms of celiac and how do we diagnose this. And then in other videos later on this week we'll talk about treatment and how celiac disease is different from gluten sensitivity or how that can play a role. So let us begin. So what are some of the symptoms for celiac disease? So celiac disease symptoms can range from a lot of different things, and some of the things that you may be aware of or heard about include symptoms like diarrhea, bloating, constipation, nausea or vomiting or stomach pains. These are all very common GI symptoms for celiac, and when a lot of people think of celiac or gluten intolerance, they think about these particular symptoms, specifically the GI issues that a lot of people have. You may have people who say that, oh, whenever I eat wheat or bread, I feel a lot of bloating, pain, constipation, diarrhea, upset stomach. It just hurts a lot. And a lot of people think they have celiac because these are all very common symptoms of patients who have celiac. But there are a lot of extra or non-GI symptoms from celiac, and they range from anemia, having mouth sores or ulcers, even ADHD or depression, especially in young adults, an abnormal level of your liver enzymes, joint pain, brain fog or feeling confused or whenever you ingest gluten or not like yourself, deficiencies in certain vitamins including iron, D, calcium, and B12, and skin rashes as well. And so a lot of the non-GI symptoms of celiac can be manifested in a lot of people, and they don't even realize that they have celiac disease. So there are a lot of patients who come to me who have a lot of brain fog or joint pain, and then we do testing for celiac. We actually find they actually have celiac, and once we put them on a gluten-free diet, these symptoms go away. In fact, a lot of people would have a lot more of the extra or non-GI symptoms for celiac than the actual symptoms for celiac disease, including diarrhea, bloating, and abdominal pain. So celiac, the symptoms can range from a wide variety of things, from GI related to non-GI related, and sometimes it can be hard to determine if somebody has it, which is why we do diagnostic testing. There are a couple ways that we can diagnose celiac disease. The simplest way that we can do that is a very simple blood test, and this is called a TTT, or a tissue transglutaminase. This is probably the most sensitive test for celiac disease. However, in order for this test to be positive, you have to be on a gluten-rich diet. And if you're on a gluten-free diet and you try to do this test, it's going to come back falsely negative, meaning it may come back as you not having celiac even though you actually have the disease. You have to be on a gluten-rich diet to have a positive TTG. Now, there's also genetic testing that we can do to help us determine if you actually have celiac or not. The good thing about the genetic testing is that you don't have to be on a gluten-rich diet to do the testing. The testing for the gene for celiac does a really good job of ruling it out. And so if you have a negative gene test, you're almost 90 to 95% sure that you don't have celiac disease. However, it's not a very good test to see if you actually have it because there's a good number of people who have the gene for celiac but don't actually have celiac disease itself. So the most sensitive test for celiac is a TTG. You need to be on a gluten-rich diet to have that. But a very good test to rule out celiac is a genetic testing for the disease. Now, once you have a blood test that supports the diagnosis of celiac, the next test is actually get mucosal biopsy. So we actually do an upper endoscopy or an EGD. This helps to confirm whether you have celiac disease or not. And what we basically do with this is that we want to get mucosal samples of the small intestine. So we actually take samples of the small intestine and we look at it under the microscope. We see if there are characteristics of what we could find in celiac disease, whether it's loss of villi, inability to absorb certain nutrients or vitamins, and we actually can grade the damage as well. And so when you have celiac disease and you ingest the gluten, you actually lose the villi that are normally there. They become flattened, and we can actually see that under the microscope. And whenever we do see that, this helps to confirm celiac disease. So in summary, the symptoms of celiac can range from GI symptoms, pain, diarrhea, upset stomach, constipation, to non-GI symptoms, whether it's anemia, deficiency in vitamin D, joint pain, brain fog, even abnormal liver enzymes. The best way to test celiac and the easiest is with a simple blood test, but you have to be on a gluten-rich diet in order for us to have a good test. Or we can do genetic testing, and the genetic testing actually will help rule out celiac disease. In the upcoming lectures, we're actually going to talk about the treatment for celiac next and some of the new treatments that are out there. And then lastly, we're going to talk about what exactly is gluten intolerance or gluten sensitivity and how that's different from celiac. I know a lot of patients have concerns that they have allergies to gluten, and I want to discuss what that is, how we diagnose that, how we treat that, and what the difference is between that and celiac. So stay tuned. I want to thank you guys for watching my video. If you have any questions, I would encourage you to contact me via Facebook, or you can always put the questions down below. And if you haven't already and you're enjoying these videos, I would recommend for you guys to subscribe to my newsletter. I put out a very simple newsletter once a month talking about various GI conditions, and what you can certainly, I would appreciate if you guys would sign up for that. I'll put the link in the Facebook Live posts.